I'm going to walk you through the ACSLPA guidelines for support personnel. Sharing my screen with you so you can see those guidelines. I'm going to explain a little bit about how it works. So ACSLPA is the Alberta College of Speech Language Pathologists and Audiologists. You are not responsible to ACSLPA, but your supervising speech language pathologists and audiologists are. So a lot of the decisions that we make, or a lot of the processes that we have in place, are to protect ourselves to ensure that we're adhering to ACSLPA's guidelines. So these guidelines really are requirements for us, but they impact how we supervise and what work you can do and how we make those decisions. And so it's also important for you to be aware of them, because then you have the ability to advocate for yourself and what you need from your supervision process. I'm going to skim over the table of contents and the little guidelines and acknowledgements and get to the meat of this. So a support personnel can have a variety of different titles. You could be called a speech language pathologist assistant, a communicative disorders assistant, a communication health assistant, a rehabilitation assistant, special needs assistant, speech language assistant, therapy assistant, educational assistant, or classroom aide. Those are the most commonly used titles in Alberta. As an audiology assistant, you might be audiologist assistant, audiometric technician, hearing aid technician, speech and hearing assistant, therapy aide, therapy assistant, speech language pathologist assistant as well. So these are the different titles, but in Alberta, you can only be supervised by a speech language pathologist or an audiologist, depending on the work that you're doing. It's also important to note that it is a conflict of interest for a business owner or an employer to be supervising the speech language pathologist or audiologist they work for. So there's been a few cases where therapy assistants have actually opened their own companies and hired SLPs or hired audiologists, and that dynamic is challenged. So this graphic here is, we're going to come back to this repeatedly because it describes how the relationship should play out. So basically, when there's a relationship set up between a therapy assistant, a speech language pathology assistant, as well as an SLP or an audiologist, we have a requirement to affirm the prerequisites for the skills that are required for the job. We have a responsibility to understand your skill set, your specific skill set, and then we determine the activity of best fit based on your skill set. We assign the activity based on all of those prior bits of information. And then once we've established what you can do and assign those activities, then we're responsible for providing clinical supervision for those activities. So there's some nice little graphics and there's a summary at the end, but the first graphic is how we determine your knowledge, skills, and competence to be able to decide what tasks you can do. So from least qualified on the left to most qualified on the right, we're considering the education that you have, we're considering your experience, we're considering where you've worked, and what tasks you've done repeatedly in those previous positions, and also trying to identify what your training needs are for the specific skills required for the job that you've been hired to do with us. So in determining the activity fit, we are going to consider risk. This is really important. There's not a lot of really risky tasks that you'll do as a therapy assistant, but if you're working in a hospital with, feeding or something like that, feeding and swallowing assessments, then there's a little bit more risk associated. Or even if you're working in a school with a child with high medical needs, then there might be some more risk associated with that. So to help us understand the risk, we're considering it on a continuum of low or minimal risk up to high or significant risk. And we have to think about the nature of the activity that you're doing, the likelihood of an adverse event occurring, the specific client. So if we have an unpredictable client or a violent client, then we have to take that into consideration. Your competence and confidence in the job that you're doing. And then also your relationship with us as the supervisor. And the reason for that is that we build trust by developing that relationship and having consistency to see how you handle different situations, to be able to understand how you're going to be able to deal with those risks. So we consider things like how stable a client is, how complex the activity is, how clearly defined the activity is or the situation is, how stable things are. Okay, so here are some examples of some of the clinical tasks that we might assign to you depending on whether we're a speech language pathologist or an audiologist. So routinely, my therapy assistants are doing screenings. They do both speech and language screenings as well as audiology screenings. They're helping with client assessments. So sometimes they'll be getting good background information for me, doing surveys by phone prior to an assessment, that kind of thing. They're often helping with one-on-one and group intervention. Our therapy assistants do a lot of one-on-one supervised therapy, but we also have them involved in planning and implementing many of the group sessions that we do as well. They facilitate communication and related skills in natural settings and help with public education events. And then for audiology, those are different. There are different tasks like helping with doing audiology screenings, but also helping with audiological assessments and helping with taking ear impressions, assisting with components of the hearing aid or FM systems, which are amplification devices. So doing some work with the amplification as well as public education. This is a graphic about hearing screenings that you'll get more information about in your coursework. So we'll leave that. Okay, so then it comes to assigning the activity. Typically, when we assign the activity, we should be giving you pretty clear direction on what you're going to need to do. So that would be in the form of an intervention or a care plan. And there's example templates at the end of this document, as well as a supervisory plan. There's no requirement for the speech language pathologist or audiologist to supervise a certain amount of the time. A lot of us therapists who have been doing it for a long time have history with ACSLPA, knowing that they used to recommend that we supervise 10% of our therapy assistants' time. That's old information. Now it's really based more on the tasks that are being assigned, our confidence in your skills as a therapy assistant, and we make those decisions on a case-by-case basis rather than being expected to supervise 10% of the time. So once we've assigned the tasks and given you good, clear direction, and we're responsible for supervising those tasks. And this might be in the form of direct supervision, where we're sitting in the room with you, watching what you do, giving you feedback. It might be having you assist us with restricted activities, so things that you actually can't do, but you can support us to do, such as setting up, a feeding assessment, that kind of thing. And then indirect supervision as well. And I do this a lot because I work in rural areas with therapy assistants who are traveling to rural areas. And so I am sometimes getting just an update by email about what's happening or reading the documentation from a visit, reviewing, video clips that a parent might send me, that kind of thing. And the way that we determine how much supervision to provide, like I said, there's that old knowledge of the 10% of the time, but now we're looking at the nature of the activity, the likelihood of anything going wrong, the client's conditions and needs, the anticipated rate of change. So we might supervise less if we know that it's a child who's going to make really slow change because of a diagnosis that they have. And we might supervise more if we know that a child is going to make pretty rapid change, or if we sense that a child's going to make pretty rapid change, because you're going to have to be constantly changing what you do. Our relationship to you and your competence are also important considerations. So there's the supervision guide, and